We have some really great speakers lined up for Intent to Invent. So I really hope you enjoy what we have put together for you and what our speakers really have to share with you. So I'm pretty sure you guys will really enjoy what's going to be happening today.
So I would just like to start off by telling you what iGEM is and what we do essentially. So iGEM stands for International Genetically Engineered Machines, and what we do is that it's a synthetic biology competition that's held at MIT every year. And it's divided into regionals and finals, so the regionals usually include areas like East America, West America, Europe, Asia, things like that. And it's basically us telling you guys and trying to show you what synthetic biology essentially is what it is, what it does, what it is for the world today, what it can hold in the future. And I'm going to get Ekta to tell you about what synthetic biology is.
So I know you guys have heard us talking a little bit about synthetic biology, but what exactly is it? So we have these two pictures here. Here are a bunch of bricks which have been put together in kind of a haphazard formation, and then you have something over here on the right side, very nicely put together in pieces. So what's the difference between both of them? So essentially, what we kind of consider as genetic engineering in today's day and age is just finding pieces that might work together and then shoving them in haphazardly. So that's what that picture is over there. What synthetic biology is it takes engineering principles and it applies it into genetic engineering. So you're going to use rational design using a well-characterized set of parts and tools. So haphazard construction, and this is what we call engineering. So synthetic biology, kind of in this industry, we call it a real quote-unquote genetic engineering. So when you think of synthetic biology, think of modularity, think cut and paste, and think of Lego, putting pieces together. And that analogy was taken from Jamie Davis.
So as we've already mentioned, we have three great speakers joining us tonight. The first of which will be Dr. Gord Surgener, and he's the president of Ontario Agri-Food Technologies. And he's had over 30 years of experience in the industry, bringing innovation and commercialization to the agriculture industry. And he'll be speaking first.
Thank you very much, and pleasure to be here. And where's the guy that's keeping me on like 20 minutes? Over there, okay? Thank you very much. So I'm going to be talking about agriculture and beyond. And part of that will be about synthetic biology, part of it will be about genetic engineering, and more importantly, it will be simply about the knowledge base of genes and what that means to the future. Oops, on one side. Okay, just to explain who I answer to. First of all, my science, my PhD is in mosquitoes and black flies. That's what I worked on. So I didn't have a lot to do with genetic engineering per se, or plant breeding or anything like that, but what happened was I became the head of all plant research at the University of Guelph, where I was technically a faculty member for 28 years, but I got seconded away to head this organization, which is our farmers, our industry, universities, and we did a lot of things from government. I want to emphasize that's one of the things that we do, is we get money from government to do things the government can't do. And that means make a decision in 48 hours, make sure the companies have the money in 48 hours and pay them in 48 hours, and we get the money to do that. So when you look at biotechnology, first of all, where do we apply this knowledge? Medical, and these are blood if you like, agriculture green, marine blue, and industrial, which is often called white biotechnology. I'm going to be talking about green and white. Where do I apply this knowledge in traditional agriculture? And then where do I apply the industrial, which is really the microbes? And in my opinion, that's probably where most of the business, a lot of the business is going to be, is on the industrial microbe side. So, and I use the broad definition of biological knowledge for the betterment of humankind. That's really what we're talking about, particularly genetic information. Genetic engineering, synthetic biologies are all extremely powerful tools that we really created within the last, I'll say 25 years, and heavily regulated, very costly to bring to the market, and in my opinion, we need those regulatory, but so far we haven't had any major problems, and I think that it will stay that way, hopefully. Okay, so back to biology and genetics. We have been selecting since civilization began. So really we are selecting genetics. We had no idea what we were doing, but we took the bigger dog and we kept putting the bigger dog together. We took the little dog and we kept putting the smaller dogs together, and on it went. And we did the same for cattle, we did the same for chickens, and on and wheat, corn, soybeans, on it went. So we have been in the phenotypical selection rather than genetic selection, and have been doing that since civilization began. And it occurred before we had, scientific journals or any of those kinds of things. There is the original corn plant, teosinte. Where did corn come from? I'm going to give you a couple of little quick agricultural lessons here. So where did these things originate? Corn originated in Central America, essentially. And there's the little starting grass plant. There it is, as you see it today. And when I grew up, we got 45 bushels of corn per acre. How much corn per acre do we get now, on average, and what are the types? 45 when I was born in Newmarket, so a decent agricultural country. 45 bushels an acre. Now, regularly we're over 200. This year we're going to average about 160 because we had a big drought in the summertime here. So we have been constantly selecting for yield. We have been constantly selecting for different traits. The corn you see out there in the fields is not peaches and cream. That's a variety that disappeared about 10 or 15 years ago, but we still call it. The multi-bicolor is really what it is. So sweet corn is different than what we call dent corn, and we use these things to do a whole bunch of different things that you probably don't think of. Here's vegetables, cabbage, broccoli, cauliflower. You can see the various things. You know what? They're all the same species. So you wouldn't think they're the same species, but again, it comes back to familiarity. If you saw a Chihuahua and that Great Dane and you didn't know anything about dogs, would you say they're the same species? No. And you think about all that variation that's out there that we have created. Go to watch the Westminster Dog Show, and you'll see what we can do by just phenotypic selection. So that's what we've done here with the original ancestors and same species, and it happens to be in the crucifery family, and we selected for roots, we selected for leaves, we selected for buds, and on it went. So we have been doing that. This was not before we had, quote, genetic engineering or, quote, synthetic biology. We've been making lots of changes. And we've been crossing species, too. Most people don't realize that. Here's a beefalo, which is half cow, half buffalo. I must admit the species we crossed were very close. Triticale is a cross between rye and wheat. And on and on, not on and on. There's not a lot of it. There's a mule. It's a cross between a donkey and an ass. So we have been, literally thousands of genes between closely related species moving them. But what became the powerful tool was we can take traits that were outside the gene pool and incorporate them into a plant. We could take a gene from a bacteria, a BT, Bacillus thuringiensis, and make a CRISPR and get insect control. And we could get insect control directed against Lepidoptera. I'm an entomologist, so against caterpillars, and one against rootworm, beetles. So different kinds of bacteria, different things. And then we could get another gene that would resist herbicides, so that became Roundup Ready. So the first wave was really about what I'll call bioprotection of the plants. Current wave that we're working on very rapidly right now is drought tolerance. So these are, how are we more resistant to extremes of weather? Drought tolerance, cold tolerance, heat tolerance, salt tolerance, and there's a number of other things there, and that's where we are. The next wave after that, and it's already there, is how do we change the functionality of that plant to create new oil profiles. So if I want a low uricic acid, I take rapeseed and I make canola oil. Anybody know what canola stands for? Canadian Oil Low Acid. Developed it in 1992 out of Saskatoon, and Saskatchewan actually, and it's canola, not rapeseed anymore. But what we were looking for there was tricks. We have soybeans now with the same oil profile as olive oil. We got rid of the trans fats. We can do all those things now which are in the traits. So I can take a corn that produces nothing but starch and I can give you a sweet corn, which is all sugars. We've done that through traditional, now we can do it through genetic engineering as well. And I would emphasize through synthetic biology. So I'm going to show you right now just the kind, by the way, this is partly business here, so I'm on the board of performance plants, have been since 1997, I believe it is. This is a technology, it's a group of technologies that came out of Queen's University. And back to why I get excited. So these are your old tomato plants. These tomatoes, and it's day 3 without water. So day 4 without water, day 5 without water. And on day 13, we're going to give them water. Now you tell me which ones have technology when we're done. So day 13, we're going to give them water. Now think of the millions of acres this past year in central United States where the corn went, just dried up, the soybeans dried up. Think of the extremes, edges of Africa, etc. And the millions of liters of tractor power, human power, that all went to waste because of a massive drought. I'm not sure this could have handled all the drought that occurred there because it's not only that, but that's drought. We also have heat, seed size, all those kind of things, and we license them to big companies. Syngenta, Bayer, cotton's a nice one for watered, but a couple in China, India, other places. What I love about it is it's a methodology where we can very much protect a whole bunch of resources. So we invest tremendously when we put the seed in the ground. This is what we call the next wave, which is protecting it once it's in the ground from the extremes of physical environment, not the biological environment. Okay, now I need to go on. Sorry. That's called yield protection technology. That's what YPT. So this technology basically came out officially in about 1992. Canola was one of the first things. It's now moving around the world. Brazil, China's going to come on stream. India, cotton is the non-food crops is pretty well everywhere. Europe is a big holdout, but South America, North America, and just here in our farmers, this is, by the way, 2113 last year, Canadian farmers, 21 million acres of canola, 97% of which was enhanced, genetically engineered, whatever you want to call it. And that was a $12 billion source of income to our farmers in Western Canada. So this technology has value. Nothing bugs me more because I work with farmers all the time and academics say it has no value. That's saying farmers have been stupid for the last 20 years. And believe me, they are not stupid. They have had huge selection pressure. So we've gone through lots and lots of controversy on this GMO thing. It will still continue because it's new. And I do want to emphasize there is risk. There is no such thing as zero risk in what we do. But what we have to have is great regulatory systems. We have to analyze it. And so far, we're okay. Doesn't mean the next one couldn't have problems. But I want to emphasize, how many crops here are native to Ontario? Just another little trivia question for you. And if you have some, name one. Pardon? Potato. That came from Peru, South America, went to Ireland and came back. Remember, what was Ontario 11,000 years ago, 12,000 years ago?
Berries.
What berry? There is one berry, a couple of berries.
Blackberry?
No. Cranberries and blueberries. Those are wild, those are native. The ones you get in the store are much more enhanced now, but we can go pick wild blueberries and wild cranberries.
I'm not sure if you consider this a crop, but maple trees?
Okay, well, I'll give you a maple tree. On the edges, like fiddleheads too could be too, but how about on the animal side? One animal. Turkeys, okay? Turkey's the only animal. Everything else that is here in this province has come from somewhere else in the world. So you want to talk about change and diversity. But 12,000 years ago, we were essentially under a glacier here. So it's not surprising. So you name the crop and you'll find most of them came from Asia, soybeans, pigs, horses came from Central Eurasia. When the Spaniards came here, that's how they won the battles in many cases. They had a horse and the Indians didn't. It was that kind of world. So we now have all kinds of plants. For example, here's our latest technology. I just brought these out. This is February 2013. DHA is the best of the omega-3s. It's the one you get from fish oil. So we go catch a whole bunch of krill off Antarctica, grind them up, get the oil, and you get your DHA omega-3 tablet. Now we can do plants. Here's Brassica napicus, 12% DH in the seed, such that 10,000 fish. So what is that, 1 acre of production? The author suggests that 1 hectare would be the equivalent of 10,000 fish. So again, that's where we're going now into the added value products. The adaptation, here you go, soybeans, cotton, canola, but essentially it's only 4 crops to date that have genetic engineering associated with them. But every crop has had selection and genetic selection. But there you can see since 1996, the take-up by our primary producers. And here's the adoption of, for example, cotton in India. First came on in 2003, and now it's at about 85%. And again, if these things do not provide value to the primary producer, it's not going to be taken up. Question is, does it provide value to the consumer who eats the stuff? Not necessarily. I'm the first, other than holding down prices. I don't see it. But the next wave, you want trans fat free, you want omega-3s, all of that is coming in that 4th wave on the crop side of the equation. On the animal side of the equation, the first salmon's coming out under FDA, final stages of FDA approval, Aqua Bounty. If it happens, we can just start producing salmon like crazy and I want to emphasize, in ponds, not in the ocean, sterile, but they take half the feed, grow twice as fast, all those kinds of things. So we can stack heat tolerance, drought tolerance, omega-3, olive oil, all of that. But remember, the most important thing here is the knowledge base. How do we select? What are the SNPs? That's where you really have to understand that this is one tool in a whole array of tools of selection. And I'm just going to quickly, where am I time-wise? We got 5 minutes?
Yep.
Okay. Where I think one of the biggest areas is in oil replacement. Regulatory, we regulate. Here's a key thing I keep emphasizing. We do not regulate biotechnology or GMOs in Canada. Scientifically, that is absolutely the right thing. We regulate novelty. So it's not the product, it's not the process that you regulate, it's the product. The product you eat is what causes risk. Whether I got there by genetic engineering, whether I got there by traditional selection, whether I got there by mutagenesis, whether I got there by synthetic biology, doesn't decide. It's the product that you regulate, not the process. In Europe, they regulate the process. And we have been great because, in my opinion, because we are very scientifically valid in our methods. So 15 years since crops, no documented human illness, about 3 trillion meals, billions of animals. The other way we tell if this is safe is we measure chickens' efficiency, feed efficiency, to the second decimal point. And we're feeding them 90% corn and soybeans that are all now genetically engineered, and our feed efficiency just gets better, our number of eggs per bird gets better, our mortality rates keep going down. So we've got literally hundreds and hundreds and hundreds of millions of chickens through 15, 20 generations. A chicken generation, by the way, between an egg hatching and Kentucky Fried, how many days? First of all, I gave you a hint. You measure it in days.
17.
28 days. But think about all the generations that we looked at now. So this is what I mean by this. I had a big fight with Ag Canada at one time in my career that we have to regulate novelty. Here was Agriculture Canada, AC Navigator, and its potential success represent a whole new type of extra strong Canadian durum with increased gluten strength over 3 times higher than conventional durum. Notice the bold there? So I went to the regulatory people and I said, here's my headline. Agriculture Canada increases celiac trigger by 300%. by traditional breeding. Gluten is the celiac trigger. That is far more risky than anything I've dealt with, and we don't think of it that way, but fortunately we have a good regulatory system. So where, and it wasn't on your agenda, but where I think a lot of the future is going, I'll just give you examples, is our new livestock. In agriculture we have a whole new thing, new kind of livestock. Instead of cattle, beef, chickens, etc., I've got yeast, bacteria, fungi, protozoa, and we grow them in vats. So if you look at yeast right now, one of the big things we produce is ethanol. All across, 5%, probably 10% of all the gasoline is coming out of plants here in Ontario, and it's made because we have yeast. So I take corn and I make ethanol, I make carbon dioxide, and I make DDGs to feed back the animals. I can take fungi. How many have heard of Youngblood's hour here? Let me put it another way. How many have had Mike's Hard Lemonade? People don't party around here. There's not a lemon to be seen in that lemonade. So the lemon flavor comes from a fungi, which is grown in vats in Port Colborne, Ontario, with a company called Youngblood's Hour, JBL we say, and that's the citric acid. The alcohol comes from Tiverton, commercial alcohols. By the way, most of your vodka, the alcohol part comes from that too. Combine the two and you got Mike's Hard Lemonade with some water. So, it's all corn and water. But we're starting to grow, most importantly, we're growing a whole new range of plastics. So how many have heard of companies, so if you guys are working on the business side, Gevo. Anybody heard of Gevo? Okay, Gevo is a company that instead of making ethanol, they make butanol because their bacteria, it's a different strain, different breed if you like, and it makes butanol. But if I have butanol, I can make a whole bunch of butyric acid, etc., so that Lanxess, which is the old Polysar in Sarnia, has invested 17% in that company because I can take that butanol from a vat in a pipe and I can go make synthetic rubber. Succinic acid, we just got a plant in Sarnia, Ontario called BioAmber. I think it's a $100 million plus investment. And it makes succinic acid. Anybody ever heard of succinic acid? What's it used for? Pardon? Yeah, okay, and we also, one of the big uses is de-icing planes will be one of the first ones. So Sarnia is a perfect one for all the winter airports, as I call it. But it'll be used as a basic building block for plastics. So almost every day you see new, some of it's synthetic biology, but some of it's new microbes. But we in agriculture, those feed on sugars. So the question is, where's that sugar going to come from? And how do we get it there in the most cost-efficient way? So in ethanol, we've been using grain corn. Now we're moving to the stover that's left over, but making sure we maintain the organic matter in the soil. Big studies going on that. But it'll probably, hopefully, be done in Sarnia. So we're feeding a whole new, just think of it mentally. Instead of feeding a cow, I'm feeding this yeast, this bacteria, and it needs this kind of sugar profile, and I can make it grow a lot faster. And by the way, most of those have probably 30 genetic inserts in them. So how do they not build up too much so the population collapses? How do you handle very high temperature? How do you handle high acid? And on and on and on it goes. So how many have heard of PLA here? Good. I went to the first opening, polylactic acid. That's the first of the biodegradable plastics. There's 7 new plastics coming down the pipe. Succinic being one, PDS it's called. And they're all being produced not by chemical reactions, but by fermentation reactions. And we've got to get our new livestock working better. We've got to figure out how do we increase our yields and the sugars necessary and get it to our farms, which are actually big vats and chemical valleys. And then those chemistry comes out and they can make synthetic rubber, I can make plastics, you name it. And it's really up to the imagination. We can do the microcarbon for planes, we're doing that. So that whole world, if I had one area, plants are a lot more difficult than microbes. And then once I get something in the microbe, I can do I can do what we call directed evolution very quickly. Everybody knows what directed evolution is? How many have heard of the one? I'll just finish with one more story. How many have heard of the company Pond Biofuels? Ontario-based company. Out of St. Mary's, Ontario, St. Mary's cement. When you make cement, you put a hell of a lot of CO2 into the air because you're cracking calcium carbonate. They have a type of algae that will feed only on the flue gas. Like, it eats the flue gas from a cement plant in vats. And then they can select it out, and it produces oil. And from that oil, I can make omega-3, I can make biodiesel, and all that kind of stuff. They said, I don't want these algae to stick to the tanks because it's going to affect the light. How many have had a fish pond here and seen the scum? A lot of people don't like pets either. Okay, so the point is, how did they get scum-free algae? You know, and I'm sitting there, oh, that's interesting. Is it going to be genetic engineering synthesis? Nah. They got a big tumbler. They put the strain in that did the things they wanted, and they had rocks tumbling over and over and over and over again. And every algae that stuck got killed because it got crushed by another. And within 3 months, they had non-stick algae. But what the guy said to me, he said, Gord, you got to realize the algae will turn over twice every 24 hours. So we really did 10,000 years of human evolution in that 3 months in terms of selection power. So that's what directed evolution is. So you can do the same on slowly raising the heat, all kinds of things. So it's not always about the high science solution. Use some common sense as well. With that, I got to go over my 20 minutes, right? And I'll be happy to be later for talks or questions, or we do it all at the end.
At the end. Yeah.
Okay?
Okay, so up next we have Dr. Catherine Burns, one of our very own. She's from the System Design Engineering faculty, and she's also the director of the Biotech and Bioengineering Center at UW.
Okay, thank you for having me here tonight. So I wanted to frame this from a perspective of trying to bring together. I'll start by introducing myself. So I direct the Center for Bioengineering and Biotechnology, but I am not from a bioengineering or a biotechnology background. Okay, and so that might lead you to ask, why am I here and why am I doing this? So a lot of what this talk is directed towards answering that question. Okay, because I'm doing this because I think it's a very important area to be in. I think you guys are the future, and I think this is really the cusp of probably one of the most exciting emerging technologies that we're going to see in the next 20 to 50 years. Okay, and I think that's really important to say. And you know, if I can say anything, if you can impress somebody who's not in your field about how important this is, I mean, you're making an impression. So that's the direction of my talk, is why I think this, as kind of an outsider who's maybe a bigger kind of overview of it, why do I think this is so important, and why I think it's going to be even more important as we move forward. So my background actually is systems design engineering, so I do take a bit of a system approach to things. Most of my work has been in software and technology, so it's a bit influenced by that, as you'll see from my first quote. So I'm sure you guys recognize this fellow. In my field, he's considered like almost a god, because I'm in the user interface area. Okay, and my students, they admire Apple, they worship Apple, that's their dream job, to work at Apple. Okay. When I read the Steve Jobs book that came out just before he died, this quote struck me with so much power. You know, as somebody which I viewed as a leader in my own field, as somebody who has had, through his life, had an uncanny knack of knowing what was going to be the next best thing. You know, if you just kind of go through that quote, you realize he was starting to see it too. So, digital technology, to me, that's what was the past 50 years. I actually think you guys have an opportunity to be the next 50 years. And that's really why I'm here tonight, to try to convince you of that. So, let's look ahead to the future. Okay? So, if you start reading things that are going to happen in the future, there's an awful lot focusing on 2030, 2050. I picked 2030 because it's not that far away in the future. oddly enough, this is General Motors' concept of what 2030 is going to look like, that you're going to be driving around in weird little blue bug cars. I kind of hope it's a Tesla, is really what I prefer. But anyhow, that's the idea. So 2030. Okay, so I want you guys to think about where you're going to be in your career. So 2030 is far off, but it's not far off. Okay, so when 2030 comes around, I'll probably still be here, but I'll be looking at retirement. So it doesn't bother me that much, as long as the real estate prices in Florida are good. But you guys, think about how old you're going to be in 2030. Okay, you're going to be probably mid-career. Okay, so you'll be married. You'll be having 1 or 2 kids, perhaps. But you're going to be exactly at that point in your career where you have established yourself. Okay, you've got a bit of seniority. Okay, you're not quite looking at retirement yet. But those are really the years where you're asked to make a difference. Okay, this is going to be your world. Okay. This is what your world's going to look like. Okay, so you have a lot of challenges coming up. Okay, and the first is people are getting older. Okay, people like me are getting older. Okay, the generation ahead of me was the baby boomers. Okay, so they're going to be sitting there on top of the statistics, and these are just very common graphs that show up all over the place. Okay, so some of our details here. 19% of the population will be over 65. What does that mean? We've got fewer people in the workforce. How good is our economy right now? Not hot, right? What's it going to be like in 2030? People are living longer. Okay, so it's not just this glut in demographics, but they are living longer. And in fact, statistics say if you reach 65, you're going to make 85. Okay, so when people look at that lifespan data, a lot of, if you're not taken out by accidents or early diseases, you're probably going to last for a while. 31% of older people live alone. Okay, and that might increase. I don't know. That's a lot of people who may have poor health, who may need support, okay, who don't have a lot of access to facilities and services. And the last one, 27% of older people in the US, and I don't think Canada's much different anymore, are obese. And there's no sign that that's slowing down. Okay, I would not be surprised if that number goes up. So what does that mean? Okay, a lot of healthcare problems, which are expensive on the economy, okay, which is not that great right now. And everything says it's going to be worse in 2030. Okay. So if you have an economics here, I can't see that well, so we'll pull back here. So right now, older people, okay, so we've got getting more of them, okay, and they're not wealthy. Okay, we've got 87% of them off of Social Security now. Look at those median income levels. Ladies, $14,000 a year. Okay, that's not a lot of haircuts or shoes. So that's not a very nice lifestyle, $14,000 a year. Healthcare costs. Okay, look at those last numbers. Okay, Canada's debt is anticipated to grow 260% by 2050 due to healthcare costs. Who likes paying taxes? By 2030, you're going to be paying taxes, I can tell you that. You may not be now. You're going to be at those tax-paying years in your life, so that will be affecting you. The issue is environmental. We haven't been taking very good care of the planet. There seemed to be a lot of attention on it maybe 5 to 10 years ago. From my own observations around 2008 when the economy tanked, a lot of the interest in environmental stuff disappeared. Okay? It's very, very hard, I think, for people to support both. Okay? And when you're poor or when your country's developing, it's very, very hard for you to be green, okay, and to worry about air pollution, okay, and worry about how you keep the world well, okay, when your population's starving. Those are not an insignificant number of effects, okay? 6 million deaths per year due to air pollution. We should be able to do something about that. Losses in agriculture and fisheries, right? So without some of these new technologies, it will be very, very costly. They're saying the global temperature rise will be 1.5 degrees by 2030. I'm an engineer and I'm a systems engineer and I know how things get into vicious cycles. I actually think that's probably an underestimate. I think you're going to see that sooner. oil and gas emissions increasing, okay? So it's going to keep feeding the problem. It's not like we're cutting it back. And it's really, really hard to. Okay, how do you go to a country like China that's trying to develop, okay, after we've been polluting for years, and say you guys cut your emissions because all of a sudden the world's getting bad, okay, when they're trying to get somewhere. Very, very hard problem. Backwards, okay. Population growth. This ties into the aging, okay, but it also ties into population expansion. And most of this is not in the Western world, okay? And how are you going to feed these people? Okay? A lot of people starving right now. Okay? And we're not nearly where we're going to be at that time period. So we're going to have some choices to make. Okay? You're going to have to think about what's going to be more sustainable for society. Is it going to be better for people to be in hospitals, which are very, very costly? Okay, are we going to need technologies that are going to allow people to live at home and live healthier? Are there going to be things that we can do for that? When are you going to get to retire? Are you guys retiring at 65, 75, 85? Okay. Think about what those numbers would be like. Okay. And will you be healthy enough to do that? If you need to work longer, will you still be healthy enough to do that? What are we going to need to support people so that they are actually healthy? I think this is going to be an important thing. That as people age, they age in a healthy way. Okay, and what are the components for that? Okay, and it's not obesity in hospitals. That doesn't keep you working in a healthy way. How do we control our environmental problems without astronomical economic costs? Okay, without thwarting growth in other areas, okay? Because we kind of need to be able to handle both, keep going. Are you going to be able to develop better foods, okay, so you can handle some of these problems? Okay? Or are we going to have people starving? What's the answer to that? Can we afford to do this? Okay, so it's like the little kid up there, you know, do you want the red velvet cupcake there? Or the apple? You know what's good for you, you know what's bad for you. A lot of times we pick the bad thing, right? That has consequences, and they're going to show up. So you got some challenges, okay? And I think one of the challenges you guys have is getting a bit of social acceptance for your field, okay? Because this drives me nuts because I am an engineer, and I love seeing technological solutions for things, you know. And I love to talk because I love seeing things that do things for people. This kind of stuff drives me nuts, but it's out there. Okay, so I think that should be a mission for you guys to go out and educate your peers and tell them how good this stuff is. And let them know that we've been doing this for generations. Okay? And this really isn't that new. In fact, we probably have better control now than we've had before. And get some of that fear out of the way because it's going to be a solution that you're going to need. There's not going to be a choice. The OECD views on things. Okay? So what are they saying? Just kind of identifying the key words in the blue there. But they're saying they have to do this. Okay? So you're going to have to improve the plant and animal varieties. There's no choice on that. Health systems, okay, are going to have to be improved. Okay, and the key aspects here, okay, think about that. Linking the genetics, histories, prescribing information to outcomes. Okay, a lot of the same idea. In a way, regulating a product. Okay? Thinking about the product from that. Encouraging longer term views when we're analyzing our technologies. Okay? So that's what they mean by the life cycle analysis. It's not enough that it worked today. Okay? What's the longer term? Did it work in the future over time? What problems did it create in the end? We have to increase research investment. And a really key aspect of this is developing strong partnerships between industry and universities. Okay, so as you move forward, don't forget that we're here. Okay, we're here to help. And at universities, we can do some things that you can't do at companies. Sometimes we have a bit of flexibility and things we can access. Okay, so we all need to work together on these problems. Okay. And taking stance on global issues, okay, educating people in other countries. Okay. Having incentives. Okay, so making these things so appealing, because sometimes it's not good enough to say, well, this works better than the other one. You have to be making, at the end of the day, that value statement so people will adopt it. Yeah. And then, I think you see that with the agriculture. There's no way people are using something at 85% if they're not making a profit from it, because nobody's that altruistic that they would do that. They want to make some money. And you got to have it there. It's got to be part of the equation. You can't ignore that. Improving the regulatory systems. Longer term health outcomes. And the last one's kind of interesting, studying personalized medicine, okay, which is getting quite trendy and quite an area of future research. But understand the consequences of it, okay? Is it changing the overall system, our healthcare delivery system, how we relate to our physicians? Okay, longer lifespans, what does that mean? Okay. Socially, okay. Physically, ethically. You know, I mentioned this before. Okay. Knowing and being aware that biotechnology can be sometimes viewed as disruptive, okay, and really working hard to dispel it. I think that's very important. Working on the social misconceptions. A lot of people talk about Frankenfoods and stuff like that. Don't get past that. So some final thoughts, and this is kind of directed more towards innovation. There's one thing I have had a fair bit of experience. My career is working with small startup software companies, I guess is what you'd say. But I think the lessons are fairly generalizable. You know, so examples in companies I've worked with before, you know, desire to learn, it makes your learning system. Pebble, which creates a little watch that you can read your email on. It's very, very cool. You know, so I've had a lot of lessons and observations I've had just from working with these companies. You know, so I'd like to differentiate between a couple concepts. Okay, so first of all, creativity, which is actually having that great idea. Okay? And that's the first part. Okay, and that's probably you'll start getting those ideas while you're here at university. And the next part is sometimes almost the harder part is actually getting that to work, okay, and getting it to the next step. Okay, so don't be, have that idea, but keep working on the next part. A few more thoughts coming up here. When you're having the idea, think hard about what people need. In my experience, sometimes they don't always tell you what they need because they don't even know yet. And these are where some of the most interesting technologies have come from. When you understand people's needs better than they can express on their own. This is one of my favorite quotes, and this is Henry Ford, that if you'd asked people what they wanted, they would have said faster horses, right? Okay. We wouldn't have had cars. So always be conscious of that you just can't ask people what they need and think that you're going to get that as an answer. Okay? Dig deeper, do some deep thinking on that, because that's where your innovation is going to come from. Cross fields. Okay, there's a lot of things that come from learning about another field and taking your ideas in another area. Okay, there's a lot of innovation that happens when you do that. Always be aware of that. Keep learning and keep reading. Okay, and last thing, hang out with innovative people. When you're around people who like to spark new ideas, you start to be that way too. Okay, and it just starts to become the way that you think. Have innovative friends. Have meetings like this. In terms of bringing it to life, you will fail. There's absolutely nothing wrong with that. Okay, and don't be discouraged by it. The way it works is the people who succeed the most have also failed the most, okay, because they've had to go out there and try it. Okay, so don't think that there's anything wrong with that. It's going to happen. If you can say anything, fail fast. So when you see something going wrong, try to get out of it. Beware sunk cost bias. So sunk cost bias is where you've invested in something. Okay, that can be your time, that can be your money. And it can be an idea that's still not a very good idea, but you're really reluctant to leave it. And this is why people don't sell stocks they should sell. Okay? They've had it a long time. They invested a lot to buy it. Okay? So always be aware that there's kind of a natural human tendency when you invest in stuff to want to stay engaged with it. Don't forget your university when you leave here. And don't forget your university time when you're here. This is a really safe place to explore your ideas. And you've got a lot of faculty here, a lot of resources that can help you try out that new idea. And we can access a lot of support programs. Okay, I don't think there's ever been a better environment right now in Canada and Ontario for innovation and new ideas. And so there are a ton of programs that allow you to access university research in order to get a bit of testing done, advance that idea a little further, do some of the ground-based research to go further with that. Okay. Times have never been better for that. And you guys are really in a lucky position on that. When I finished school, everybody wanted to work at IBM or Nortel. Okay. Nowadays, I'd say, I know in systems, I probably see 40% of our class trying to do their own companies. And that's fantastic. It's a totally different model. Very exciting. When you see expertise, use it. Okay, learn to recognize it, take advantage of it. And keep in mind that as you get successful, you often have to change your model again. Okay, so as things scale with success, don't be afraid to change. If you ever get the chance to read a book called "Who Moved My Cheese," it's a good read. It's very, very easy to read. It's short, but there's an awful lot of examples of places where things have moved on people and they weren't aware of it. Okay, so keep that flexibility. Don't be afraid to change. So that's it. So what I've got on the next slide these are actually a lot of the references to the pictures that I stole off the internet. So, so I assume this is an educational purpose, so we should be reasonably okay on that. And that's if you're interested in the center, we do have student members. Okay, and so we're very happy to be part of this event. We'd like to be running more events in the future. So I'd invite you to be in touch with us and get involved. Okay?
Okay, and for our final speaker, we have Nikki Urbanaitis. She is the Director of Project Management at Patheon, and she's had over 25 years of experience in managing clinical trials for a variety of different pharmaceuticals. So please help me welcome Nikki.
Thank you. So thank you so much for the invitation. It's an honor to be here to present to you. So my presentation is going to focus on 3 elements of the pharmaceutical industry. We're going to talk a little bit about what is contract development and manufacturing, what is drug development, high level, and really for many of you who are maybe kind of reaching the end of your years at university, what is any opportunities out there in project management as you kind of move on in your career. I'm going to start off talking about some of the trends that we're seeing in the pharmaceutical industry. I would say that in the past 20 years, we've seen more and more big pharma clients moving away from developing and manufacturing drugs at their own sites. So, and this is related to, I guess, a lot of the reduction in the workforce, the lower costs that they want to incur. So many companies, as they consolidate together, they determine that perhaps they don't have the skilled workforce, they don't have the equipment, and they often come to contract manufacturers, as they're called, to develop their product. And that's one of the things that we do at Patheon, is that with the network, and I think we just went, with the network that we have of about 10 sites across North America and Europe, we're positioned to manufacture product for clients, and we don't have any of our own product. So in essence, we have one of our sites is in Toronto, and that's where I work at the Mississauga facility at 401 and Erin Mills. And we make drugs. We develop drugs from the standpoint of a client comes to us, they say, we have this active ingredient, can you take this API and can you make a capsule for us, a tablet for us, because we need it for our clinical trials. So we are able to take clients from the early stages, this kind of proof of concept, all the way to commercialization. We're able to scale up, and we're able to launch their product. So these are some of the development services and some of the dosage forms that you're able to see as this is what pharmaceutical companies do in essence. So tablets, capsules, powder, liquid capsules. There are some of the technologies. So these are all, we're seeing a lot more complex technologies out there. So it's not just the tablet. Sometimes it's a bilayer tablet. Sometimes it's a liquid-filled capsule. It's a gelatin capsule. And so these are on the left-hand side. You have some of the capabilities as well. And we'll talk about what is that gamut of development services and how do you go from here's the API all the way to a product that has been scaled up and it's ready for market. So we work with a lot of high potency compounds where you're required to be in kind of full Raquel, full spacesuits. So that puts a lot of stress on the workforce. We work with a lot of controlled substances. We develop analytical methods, and we do stability testing to ensure that the products have a good shelf life. So these are kind of, as well, some additional examples of conventional and specialized dosage forms. Conventional, you might be familiar with, but you also have a lot of sterile and as well as a lot of non-sterile products that are manufactured in the industry. If we take a look at industry segments, I guess what we've probably seen in the past 20 years, and this is just really the data for our company, which is Papion. So we're really seeing a lot of emerging companies. So and that's the section in the orange. So that constitutes a lot of the clients that we have right now. So you can see that big pharma, which typically used to be kind of a higher proportion of client base, that's accounting for about 24-25%. But we've seen in the past 5 years or so many more emerging companies and many more specialty companies out there as well. And so that's really positive because we realize that that's kind of the innovation that we're seeing in the industry, right? And with a lot of the consolidation of many of the big pharma clients, we're seeing that a lot of these specialty and emerging companies are taking over, which is really positive. If we take a look at, on the left-hand side, what is the development market out there? The pharmaceutical development market is worth about $1.3 billion. We have a share of about 10% of that. So that's about $126 million globally. And contract manufacturing, which is the commercial market, is significantly bigger market, and that's worth about $11 billion. So obviously, there's a lot that's happening in the pharmaceutical industry, and that's a kind of a great place to be. If you take a look at what are some of the important clients, large pharma and specialty pharma, some of the large pharma clients, you might be familiar with them, but we're seeing a lot of the emergence in the specialty companies. Most of the clients that we see, our client base is in the United States. I would say 80% of our clients are either in East Coast, West Coast, California, New Jersey, Massachusetts area, and of course we're seeing a lot of clients now in Japan and Korea. If we take a look at some of the key industry trends, so yes, the growing proportion of small companies, more of the pipeline of products are with the small companies. So this is really positive for us because in many cases we prefer in some ways to work with smaller companies. I guess one of the issues is that there is lower capital available to invest often with some of these companies, and so that makes it more volatile in the drug development field. We're seeing some increased R&D cuts and lower financing of development, and so there's less venture capital out there, and that's impacting the pharmaceutical industry. As well, from a technical and scientific standpoint, really the increased complexity of compounds is making formulation more difficult. So some of the compounds that are now out there, the APIs, they're not very soluble, they're less stable, and so that makes it challenging for our scientists. I think it's a really great challenge, but it's challenging to develop a viable formula that's going to be stable. As well, we're seeing, because of the cost of development, we're seeing lower percentage of phase-to-phase transition. What I mean by that is, there's a slide that talks about the different phases of drug development. That whole process in many cases will take upwards of 10 years and will cost millions and millions of dollars. We have certainly many clients where the products just die in phase 2 or phase 3, and so companies are making stricter and what we call here go, no-go decisions. So they're looking at the end of each of these stages of development to have certain criteria and an understanding of the efficacy and safety of the product and what the costs are going to be before they move on to the next stage. And certainly for new chemical entities, I think if we compare from where we were 20 years ago, we're probably seeing less of those. Of course, in development, besides kind of the science and the technical part, it's all the regulatory considerations that need to be taken into account. We know that in every industry, and certainly in the pharmaceutical industry, it's very regulated. We need to comply with good manufacturing guidelines, which we call GMPs, and these are there to protect the consumer so that we ensure that the product is manufactured and tested to ensure good quality. So we know that we have certain agencies in place that come and audit us in the pharmaceutical industry. So for example, the FDA, which is the American body, will come to our site and many other pharmaceutical sites, and they'll do audits typically about once every 2 years at our site. And what they want to look at is, what are your GMPs, what are your standard operating procedures, what is your documentation. They want to sometimes spend weeks at the site ensuring that we comply by the guidelines. As well, the World Health Organization also has a version of their GMPs for developing countries, and regulatory agencies across the world have the opportunity to come to any pharmaceutical site and audit. So just as an example, I would say at our site, we probably have an audit, whether it's from a governing body or a client. I would say once every week we're undergoing audits, and so that's an opportunity for us to make sure that all is good regarding how we do our business. In terms of the clinical phases of development, and some of you might already be familiar with this, and my next slide is a little bit more detailed. But phase 0, that's prior to first in human trials. That's when a lot of the pharmacodynamic and pharmacokinetic profiles are done on the APIs. So that's a lot of the testing of the active ingredient prior to going into humans. And so, a lot of the animal toxicity studies are being conducted at that time. As we move into phase 1, we're doing a lot of screening for safety. So we're now in a human population, often a small group of healthy patients, about 20 or 80 patients. And this is the opportunity to evaluate safety and determine a dosage range. And often products die at the end of phase 1 because sometimes the side effects are too serious. In phase 2, you're looking at a larger proportion of patients, and often these are actually patients that have the condition that you're trying to treat. So this is upwards of 100 to 300 patients, and you're looking at the effectiveness and evaluating the safety of the product. So a lot of what we do is providing and manufacturing product for phase 2 and phase 3 studies. And these are studies that are going on globally. So we might have a client that says, I need product for Japan, I need product for Europe, I need product for North America, and how soon can you get the product to us? And so, of course, that's very important to us, because the last thing you want is that a clinical trial has started, and these are sometimes very sick patients, and our client doesn't have enough product, and so imagine you're a patient and you're on this clinical trial and there's no product available for you. So these are some of the stages of development, and then as you get into phase 3, this is just prior to commercialization. So you're looking at larger groups of patients, and it's typically in stage 3. It's typically stage 3 that's the most expensive one for clients. The data needs to be analyzed very carefully to find out whether what the efficacy is in comparison sometimes to other drugs that are out there, to placebo as well. And so it's very disappointing for our clients when they find that at the end of phase 3, after having spent some of that money, a lot of that money, that you have patients that have really not done well, or perhaps from an efficacy standpoint, it's the same as a comparator drug. Now, there are as well phase 4 studies, so at the end of phase 3 is typically when a product gets commercialized, and a lot of companies are continuing to run clinical trials once a product is commercialized, because there's new indications. Perhaps they're looking at pediatric populations, so there's just a lot of opportunity there. So in essence, if we take a look at drug development, and like I said, I think the next slide's even more involved, but you're looking at elements of pre-formulation. So what do we mean by pre-formulation? Well, a client comes to us and says, I'm going to be shipping to you 5 kilograms of this white powder. It's an API, and can you please make a tablet? I need to have 1,000 tablets for my first-in-man trial, and we need them in 6 months. Okay, so it's up to us, it's up to our technologists to determine, based on the characteristics of that API, what are some of the other excipients and raw materials that will come together to make a tablet. What are some of the properties? How is it going to dissolve? How is it going to disintegrate? That's the formulation piece of it. What does the stability look like? Because stability is key. If your product is not going to be stable in some conditions, high temperature, high humidity, or in just standard room temperature, if it's not going to be stable for a year and a half, then that's not a viable product, right? So we do all of that. So and so that's what pharma does as well. You formulate. And then, as part of that process, you have a small batch size, is what we call it. So you, different pieces of equipment, and now you need to scale that up. So you need to go, in essence, sometimes from 1 kilogram of product to 1,000 kilogram of product. And that's that scale-up process that takes place. You're still looking at stability, and from an analytical standpoint, one of the things that you're looking to do is to ensure that your product has the potency that it says it's going to have, that you don't have an impurity profile that's going to kill your product, and that it's stable, it dissolves, it disintegrates, it does what it's supposed to do, and so when it gets to a clinic, the patients are going to be able to use it, and then the data that comes out of that trial is going to be useful to support the regulatory filings that the clients are going to need to do. So this one here just kind of has a lot more detail. I'm not going to go through all of this, but really just to kind of show you what that process is, from discovery all the way to phase 3. And like I said, that can take many years. It can take upwards of 10 years. There's a lot of work that's being done, and that's kind of overlapping in different phases. So as an example, I talked about formulation. Clients might come to us at the start of their this drug discovery journey, and they might say, well, I just need something fast. Can you make something fast for us? So we'll put together a very quick formula because there's time constraints. But then as you move through the different stages of development, you're going to be sometimes fine-tuning that formula as you get some analytical results as well. But in essence, it's that CTM manufacturing. So CTM stands for clinical trial manufacturing. It's the support of providing clinical trials to clients in this, I'll call it a very expensive process. And it's really working with the analytical teams to develop methods, to develop specifications, to test the product. There's no point making a product if you can't test it. You need to test it against certain specifications that have been determined, whether it's potency, whether it's the lack of impurities. Okay? So that's a little bit about, I know very, very fast, that's a little bit about drug development. And then I was going to talk a little bit about project management and what do project managers do. and what opportunities are there. And project managers, certainly in many industries, you hear about them, you kind of wonder, well, what is it that they're doing? What is their role? So really, it's managing a project, right? Managing a project, and in the pharmaceutical industry, it's overseeing the introduction of products and making sure that they're developed and commercially manufactured, and the products are on track. So you're kind of like a team lead. And so as a project manager, you are kind of the lead in the organization, and you need to ensure that your project is tracking against what that scope was, what the timeline was, the quality, and what the budget was. And these are all through the levels of development, which is the initiation of the project design, production and execution, and the monitoring and controlling of that project. And so, the project managers, as he leads that team, he's involved in kind of overseeing some of the regulatory and the manufacturing decisions that are made, and providing recommendations internally and to clients. And here in this triangle, it's the scope, cost, and timeliness, and tracking all of those and ensuring, because each project, especially each development project, is going to have issues and risks. And it's the documentation of those issues and risks, mitigating those issues and risks, and making sure that the project is going to move forward. And it's really as well, just like any project, doesn't have to be in the pharmaceutical industry, but just any project in general, it's kind of learning at the end of it what went well, what didn't go well, what are some of the areas for improvement, did we achieve our milestones? So clients or internally in an organization, our clients say, well, I want to launch in 2015. Here's my timeline. I need to launch in 2015. I need to provide FDA with stability data 18 months to show that my product is stable. So that's 18 months of real-time data. And so if you backtrack, here's when we need to be making product. It needs to go to a clinic, and then we need to give it to the FDA, that dossier to the FDA, and are they going to approve it? So those are some of the milestone reviews that are being done. And then as well, it's really, from a quality standpoint, ensuring that, as any good project manager, do you have on-time delivery? Do you have right first time? And so it's the ability to track some of those. Now, you don't do that all by yourself. Now, in essence, and I'm just kind of giving here an example of what a team looks like in the pharmaceutical industry. And often, there's the core team in green, and so those are sometimes your elements of it. You have your analytical people who analyze, project managers that lead the project overall, and then you have your pharmaceutics people and your process technology people that drive some of the technical manufacturing aspects of the product. And so the reality is, in kind of this circle, these are all subject matter experts that kind of bring together to move a project forward. And this is kind of an example of some of the levels of people, and maybe that might be yourselves one day as you kind of progress, whether the pharmaceutical industry is something that interests you, but whether it's in analytical or pharmaceutics or project management, these are some opportunities. And so what I have here is just some more of the responsibilities of a team, and what everyone is busy working to kind of progress a project. As a project manager, you're also using some tools which are very important in terms of tracking a project, and some of those are related to kind of, well, here's, I need to develop a timeline, and some of you might have already had some experience doing that for other projects or courses. So a timeline consists of, here are my start dates, here are my finish dates, here's the scope of work, here are some of the durations, here are some critical path items, and measuring kind of any slippage or adherence to a timeline, and then kind of the opportunity to also manage a project from the standpoint of looking at managing your resources, managing your profitability, your performance, and as well a budget, because nothing gets done without having a budget. and everyone is looking down your shoulder to make sure that you are in adherence to that to that budget. And often we're able to see for each of our projects which ones are profitable or not. So it's a good opportunity for all of us. So not that I'm here to sell you as to become a project manager, but just to kind of give you some ideas of maybe some particular career paths, I guess, for yourselves if you're interested. So project manager in the pharma industry. So typically we're looking at individuals who have a science degree as a minimum, Bachelor of Science as a minimum, but certainly we have people who have masters, PhDs, MBAs on top of their science degrees, pharmacy degrees. So certainly need to have that understanding of science and development. And we're also looking for people who have diverse backgrounds and experience in the pharmaceutical industry. That could be manufacturing, that could be quality, that could be regulatory affairs. We encourage our project managers. So at our site in Toronto, we have a group of about 15 or so. I would say 2/3 of the department have their project management certification. So that's a great opportunity for them, and our clients are happy to see that. And certainly as part of anyone's career in any company, there's an opportunity for ongoing training, whether that's in drug development, whether that's site-specific training as what are standard operating procedures, what are GMPs, and then of course some of the kind of softer skills that are required, which are related to interpersonal skills. How do we interact with our internal clients, external clients, team building, communication, all of that. And really, what are the opportunities out there to kind of pursue a career either in the pharmaceutical industry or in project management, and certainly to obviously complete one's degree, look at co-op employment, and certainly here at Waterloo, obviously that's a great opportunity. Any kind of summer employment. Angeli was, well, there she is. Yeah, there she is. So Angeli came to work for us last summer, and she spent probably felt like maybe 3 or 4 long months. But we certainly appreciated having her there, and she was kind of integrated with our group, and I think kind of developed good relationships with our project managers. So any summer opportunity, internship opportunity, any kind of PMP certification, but really it's sometimes it's just any work experience and any kind of looking at any networking opportunities, any trade shows, any pharmaceutical seminars, and often it's really about the interview, and I would really encourage, certainly all of you, sometimes, people don't have a lot of experience, and that's fine, they're coming out of school, but it's really that kind of positive attitude, that determination, that initiative that we're looking for, and really that is very important, and it's not just, hey, what your mark was on a what you graduated with. It's really, how you shine during a job interview and the enthusiasm that you have. And, I always say this, I don't ever take a look at anyone's marks because it's really how they sell themselves. It's really irrelevant if they got a 95. It's really their opportunity to sell me and to sell themselves on what they're able to do. And that initiative, and so that's just kind of some things to think about. So hopefully, and certainly if you have any questions, that's it for my presentation, and thank you once again for inviting me.
Thank you all so much for coming, and we really appreciate it.